nanowire was discovered by Dr. Young in US, but he discovered it for electrophysiological conditions and circuits. But we are using here for biological applications. Recently, there are some reports that even you can nanowire stem cells. And these nanowired stem cells live longer and can do much better effect than stem cells alone. This is the example showing that the stem cells are growing much healthier on nanowires. We used these titanium nanowires like scaffolds where the drugs are labeled and bound and can be released. And we were very surprised that one of our work on nanowire cerulizin for the treatment of neuropathic pain got top award in National Innovation Summit in the United States. This is government summit, occurs every year in June. This was in 2013. And not only that, they found this result so impressive that it was a spotlight interview for the US government, because the idea is that it can be used for our military personnel to treat them in head injury and also in neuropathic pain. And Society for Neuroscience is also nowadays taking very interest in nanowire delivery and stem cells. You can see here that one of our papers, nanowire cerulizin potentiate mesenchymal stem cells induce neuroprotection and neural repair following concussive head injury, is accepted in a nano symposium. And I am chairing the session as well. If some of you are going to Society for Neuroscience, you are most welcome. So, in closed head injury, making my presentation short, I can only tell you that these are untreated, 24-hour, right and left. What we have seen, if you make injury on right side, left side is much more damaging. And this is the 12-hour situation. So it's time-related injury. And when we have given cerulizin, at different time intervals, you can see that neuroprotection is quite clear. And there was also a very tight correlation between the dose of cerulizin and neuronal injury or neuroprotection. So it means the higher the dose, the longer the time, we have better neuroprotection. And of course, glial cells play active role. And here you can see that activation of glial cells are quite clear in 24 hours, and they are not so excited when we have given cerulizin. And these are the results you can see at electron microscopy. Then here in Bilbao, this is control cortex, cerulizin treatment after 24 hours, and also this is the left half, and this is left half after treatment. They are much better. I will show you the next slide, then you can understand. So this is the 24-hour left and 24-hour right. Massive damage to the neuropil and vacuolation. But look at here, at high power, cerulizin has really protected the neuropil after injury. So we can say here that cerulizin, if given using nanowire techniques, they are much more protective than the normal ones. But we have to see that in any circumstances, we should consider other factors. And these factors could be external temperature, cold or heat, nanoparticle size, disease conditions, hypertension, and even nowadays it is coming that the patients or people who are taking different kinds of drugs and they get injured, they are entirely different in pathology of their brain or traumatic injuries or even cardiovascular changes. So on this we are working together with NIDA. And I just remind you at the end that we cannot compare experimental results with clinical cases, because clinical cases, no two clinical cases are similar, but in animal experiments we have still controls, and that could be the region that some of the drug treatments or drug trials have failed. Finally, I will show you a brief example. This is an example of Alzheimer's disease. You can see that this brain is almost shrunken, and this is the expression of senile plaques in Alzheimer's disease. The point is that we have infused A-beta protein to develop pathology, and what you can see here that, and and also this is FPP mice. Cerebrolysine has done much better, and nanowire cerebrolysine has almost reduced like control conditions in mouse model of Alzheimer's disease. The second thing also, we have measured tau protein, and as you can see that in normal condition it is very high, and cerebrolysine normal, and nanowire cerebrolysine has reduced almost to near control level. Now we are working with, this is Aruna Sharma, he lives in Florida, and his idea is that he got Nobel Prize on corticotrophin releasing factors because they can influence brain function. So he thinks that what will happen if we have small fractions of corticotrophin releasing factor, either combined with cerebrolysine or without, can have much better neuroprotective effects in Alzheimer's disease. So this work, we are working together with him. So CRF fragments, and then infusion in different models, traumatic brain injury, Alzheimer's disease or Parkinson's disease, and looking for nanowire delivery of these things. Also, we had a volume on dedicated to neuroprotection and nanoneurotoxicity. This is Dr. Shelley, this is Dr. Aaron Shikanover, and this is Ole Petter Otterson. He was the chief editor of Neuroscience. They have written some good comments on this volume. So it means that we are really heading towards the right side. And just this nanowire delivery is very expensive, and we are working with our colleague from Fayetteville, Arkansas. So even past and present governors are helping us because this requires lots of money to go ahead. And this is the former governor, Jim Tucker. And I will lastly show you in 5 minutes spinal cord results. And here you can see that we have a dorsal horn lesion, leaving other horn intact so that we can study right and left side changes. And this is the situation of SCI, silica exposed spinal cord. It is much more adverse than the normal. And here you can see the tissue loss is much more severe in silica exposed spinal cord, and these are the edema and blood-brain changes. This is the sitting governor who is helping us a lot in our nanowire work, and we are really grateful to him. So in the spinal cord injury, we have tried several drugs. They are nanowired or not nanowired. In this area, we have the best drug here, and we can see that we have a drug called AP715. This occurs in this compartment, whereas all other drugs are in different areas in between. And this is the worst things compartment. So the point is that different drugs given similarly nanowired may not have same effect. So the nanowiring itself does not produce any effect. Your drug should be good, then it can enhance its capacity. But if your drug is not good, nanowiring alone cannot do anything. That's the message from this slide. And here is an example that AP713 is the best when given nanowired as compared to the untreated group. And in this case, also our former Prime Minister of Sweden is also very supportive to our research. Now we have again the Prime Minister of Social Democrat. And then Chinese government and ministry also get involved. So we are doing something with them in Shijiazhuang, that is the military capital of China. And here I stop. We have lots of collaborative work here, Labour Neuropharma, Indian University, MIT, and of course Dr. Lafuente is helping us a lot. And this is Chinese University. We have different funds from various organizations. I will not go through all of them. And I can only tell you that Dr. Lafuente is very much helping in our group, and we are doing a lot with him. And here I stop to hear your comments. Thank you very much.
¿Alguna cuestión? ¿Algún interés, curiosidad? No questions? At the beginning of your talk, you have spoken about the immobilization. stress and also having sleep loss.
Yeah, I did not show the sleep deprivation, yeah.
That could be the reason for the poor memory.
Yes, because the paper is under preparation. Military people, if they have 24 hours, or pilots, they have sleep deprivation because they do not sleep. And there are recent results from US military, now unclassified, that if sleep deprivation for 24 hours, they can't take good moral judgment. So their moral will be affected. And also, at that time, they can't solve even simple mathematics. So this is quite known. Together with Dr. Lafuente, we have shown, the paper will be published very soon, that sleep deprivation of 12 to 72 hours opens the barrier progressively and also produces brain damage. I think this is going to be first observation, but we have to wait until the paper is published. So these are our information, and we try to modulate neurochemical factors, for example, serotonin, and try to modulate certain receptors with and without nanowire. So these work are in progress.
The thing is that sleep deprivation of not only the military person, also our students. Exam time.
Yeah, there was one question when we presented this paper in Charlottesville. You were not there, I think, on that day. They are talking about neurosurgeons or the hospital doctors. They are working night duties and they have to be awake and treat their patient. What will happen? Well, in United States and India, I have the impression that many neurosurgeons at that time do wrong diagnosis if they have not enough sleep. So that is very important, but we cannot prove it scientifically unless we do some experiment. That is very difficult. But these are the problems with sleep deprivation.
Eso es, por algo lo que dice la abuela siempre, depende del examen de tiempo.
No hay ninguna pregunta.
Yes?
When you're talking regarding stress, like would you generalize according to post-surgery stress too? That type of stress?
Yes.
Yeah.
Surgical stress is also very important.
Yeah, so that would influence the brain.
Yes, and there was one paper, I don't remember, recently came from Sweden, that surgical stress opens the barrier. But I did not follow that. But since 20-30 years ago, we know that surgical stress is very severe.
Yeah.
But we need to do more experiments on that.
And all this blood-brain barrier damage that you study is reversible or?
That is very difficult to say because it depends on animal permission. Of course, in certain cases like we did in India, force swimming experiments, they are reversible after 24 hours. But in these examples that I have shown, I do not have any way to tell that these are reversible or not because we have not done it, we are not allowed to do them. And still I don't know that these neuronal damages I have shown, they might come back or they are for permanent. So these questions still require more investigations.
Yes. Thank you very much.
Thank you very much. So any day between 10 to 20 hours. I have to check whether I'm coming on 11 or something. Yeah, I should come from Uppsala to 1 day. One day before, yeah.
Did you also look at the different receptors of TNF?
No.
Because
Yeah.
I was in a group in which they researched the effect of different receptors of
Yes.
TNF. There were the TNF receptor 1, which was triggered apoptosis,
Yeah.
or was I don't remember.
Yeah, okay.
One or the other.
No, these are very good
And
questions.
receptor 2 was
Really?
yeah.
Yeah.
Kind of like promoting survival.
Yeah, sure.
I think that would be
That would be very interesting. Yeah. Thank you for telling me. We have not done it. Okay. Good.
Thanks. See you.
See you.